Is it visible?
Yes, ma'am.
Then what were the things we have discussed last class? Yes, anyone? What we have discussed in the last class? Is it audible? Yes. Is it audible?
Yes.
We have
Yes,
seen the
ma'am.
last class regarding the suture and suture materials, right? And someone had the doubt of suture material. What was that? Due to network problem that day, it was disconnected. What was the problem? What was the question? Who asked that question
Ma'am,
about the suture material?
actually, ma'am, it's non-observable, but why is not any abdominal surgery not given? But why it is required?
What it is? It is silk is a non-observable. Why it is used for surgery? You are asking.
Yes, ma'am.
Is it that the question you are asking? It's non-observable. You can remove after the stitching. You can remove the silk. You know, it is non-observable. You can use. What is the problem in that? The thinking what we use on our daily basis is not that silk. It will be the fine silk. Okay, so it will be easy to put a knot, and it will be easy to remove also. Once you come back, we'll demonstrate it, and we will see the through directly. We will see. I'll bring all those the equipment so that you can see how the sutures will be. The silk and the nylon, the propylene one, all those things. Is that clear? Okay. Today we'll see the principle of suturing. What will be the principle? How the suturing should take place? What things has to be kept in the mind before suturing? All those things. Okay. The principle is the needle should be grasped at approximately 1/3 of the distance from the eye. Eye 2/3 point. See, like this, the suture, the needle you will hold. The nothing but eye, and you should grasp it approximately 1/3 this 1/3 distance only. You will have to stitch. You have to do the suturing. Okay, and it should be perpendicular for with the tissue. Perpendicular means straight. See the second picture. It should be perpendicular while stitching. Okay, it should not be cross, or it should not be subcutaneously, should not be 40-degree angle. Okay, it should be 90 degree, it should be perpendicular. Okay, and it should be placed equidistant, that to 2 to 3 mm from the incision line. See, like this. It, from where this what do you say, the way the incision has happened, you can't directly stitch from there. Okay, at least you should leave 2 to 3 mm. You should give a gap of 2 to 3 mm. Then you should start the stitching. Directly on the top of wound, can you stitch? There will be
No,
no
ma'am.
2 to 3 mm of distance you will maintain, and we will. The first one is 1/3 distance and stitch. Okay, second one, that needle should be perpendicular while stitching. Okay, and the third one, at least 3 mm while from the wound. You have to maintain 3 mm of distance. Is that clear? Next, it is how deep you should stitch. Can you you stitch the full needle inside and can you do the stitching? No, there are in the wound, how much depth wound has been, how much deep the wound cut is. By based on that, you will understand the depth of the penetration. Okay, and see the thinner tissue. First, you will fix the stitch the upper part, then go for the inner part. Can you stitch like that? No, can't like that. So first you have to go the inner part or the thicker one. Then you will go for the thinner. Okay, inside part will be stitched first, part will be closed. Okay, because if you stitch upper part, you can't stitch the inside part, and the inside part, if it is not closed, again the bleeding takes place, right? So inner part has to be stitched first, then the upper part of the skin. Okay, and after stitching, what is main important? We have to put the knot. Yes, no? Only stitching you can do, and if you leave, what happens? It may remove. So every stitching, there should be a knot like this. Okay? It should not be so tight, and the stitching knot should not be so tight. See the second picture, it should not be straight also, and it should not be so tight also. Okay? So that it will not affect the tissues and the nearby tissues. It should not get affected. In such a way the knot has to be tight. Is that clear?
Yes, ma'am.
And each suture
Yes,
must be
ma'am.
placed 3 to 4 mm apart from the incision line. The same thing, you can't stitch on the wound. At least 3 to 4 mm distance it has to be maintained, and the suture should be 3 mm apart incision side. Like after stitching the upper part, can you see it? There should be space. Why should be space? Should be that there should be space, because it is a non-observant, we have to cut and remove it, right? In such case, the scissor has to be inserted to cut. For that, the gap should be there. Yes, no, there is no gap. How you will cut the sutures? Because of that, 3 to 4 mm, and you will put a knot. Okay, that is the principle. Next, we will see the suturing techniques. Okay, what are the different types of sutures we do? Okay, first is the interrupted suture, and second the continuous, third is the mattress sutures, and fourth is the figure of 8, and next last one is the subcuticle suture. Okay, first let's see the interrupted suture, how it looks and what is the use of that. Okay, see the interrupted suture, it will be a single tutor, and mainly we do this interrupted suture in a biopsy. Okay. Suppose the patient is undergone for a biopsy or a dental implant, we do this interrupted suture. See, after every stitch there will be a knot. Can you see this? After every stitch, after doing one stitch, you will put a knot. Every stitch, you will put a knot. This is a okay.
Yes, ma'am. Yes,
Next
ma'am.
is the continuous suture. Okay. We have seen the interrupted. Second is the continuous. Under continuous also there are three various types. Continuous itself says that continuation of the sutures, the series of sutures will be continued. Okay, and whereas the simple continuous suture, the first one is the simple continuous. In a simple continuous, you can see in a picture there is no knot. Okay, Only the stitches will be, but there will be no knot. Okay, the wound will be closed. There will be a series of stitches, but knot will be not present. Is that clear?
Yes, ma'am.
And
Yes, ma'am.
what will be the disadvantage of this? By doing the such sutures where there is no knot, if no knot in the sense after each suture there is no knot, but at the end there will be a knot. Okay. What happens if suppose a patient has a surgery of with this continuous suture, it has been done to your stomach. Okay. After once the patient go home, if you have done with some exercise or something, the suture may get ruptured. Okay. Who is that? Because of that. Okay. Unmute yourself, everyone. Okay, because of the continuous things, continuous sutures, there will be difficulty.
दीपेंदु म्यूट
First thing, there will
कर
be
रे
difficulty. Remove the suture. Okay. Second thing is continuous sutures will have, if one cut, if it is in chance of infection, there will be a, okay. The one, if it is open, one line, if it is the suture open, that opens, everything will open automatically. Yes, no, due to stretching or due to something, the sutures may remove off easily. Is it not? That is the simple continuous sutures. Okay. And next is, let's see, this is how the simple sutures looks like. See. And suture, then automatically and there will be chance of bleeding and there will be chance of infection. Because of that, the continuous simple continuous suture is the main disadvantage is that bleeding and the infection. Is that clear? Have you got how it looks like? Next is a locking continuous suture. See, first we have discussed simple continuous, and next is a continuous locking continuous suture under continuous suture. Okay. Now locking continuous suture. Here also you can see. See, what is the difference? Can anyone say? From what is the difference between the locking continuous suture and this one, simple continuous suture? What is the difference?
Simple continuous is no knot.
But only at
Locking
end
with
the knot will
every
be.
day. And locking is every suture is not.
No. Every suture locking, I have shown you before picture. See the every locking from this one. See, every stitch there will be a knot, but the difference between the simple continuous suture and the locking continuous suture is here there is no knot. At end there will be a knot. Whereas in a continuous locking continuous, see every stitch there is a end. At the end there will be a knot. Not one, but together it is a knot. It's a suture passed through a loop and made for a previous stitch. See, continuously it has been made stitches. See, at side there will be a knot. Not one, for one there is no knot, but there is a continuous loop. Can you understand this? See, the sidewise. Sidewise knot तो नहीं ढाला हुआ है, लेकिन वो कंटिन्यूस हुआ है, एक से एक के साथ एक जुड़ा गया है. Can you see like this? कहाँ नॉट, यहाँ पर तो टाई नहीं किया गया है, नॉट नहीं ढाला गया, लेकिन इट हैज बीन ए कंटिन्यूअस इन अ लूप. Got the difference?
Yes, ma'am.
Knot is nothing but this one. Every one is knot. Okay. Here there will be in a simple continuous there will be no knot. It will be continuous. Only at the end there will be a knot. Whereas in a locking continuous, every stitches will be locked by loop. Okay. One by one. How we stitch a dress? Yes.
Yes.
One will be connected there. Okay, next step is the next suture is a continuous over and over. Okay, in a continuous over and over, it will appearance is exact, okay, it will be over and over. So it is mentioned like that. Is that clear? Clear the sutures?
Yes,
The
ma'am.
continuous sutures, understood? The three types of continuous sutures, the simple one, simple continuous suture, locking continuous suture, and the continuous over and over suture. Okay. Next, we will see the things which I said before. First, the deeper layer will be stitched, then will be the epidermal one. That means the upper part of the skin will be stitched. Okay. Next is the mattress. Mattress in the sense how the stitches will be done, like how the sutures will be done, either in a horizontal way or in a vertical way, how horizontal way it will look like. Okay, we'll see these sutures how it will look like. See, now horizontal suture, like this the stitches will be, the down the line below the line you are seeing, no, those all the things which happens inside the skin, and the upper part looks like this. Are you understanding?
Yes, ma'am.
They are these are the horizontal sutures. These are inverted, okay, inverted suture techniques, and it also along with the wound edges. In a wound edges, there will be a knots. Knots will present, and this also it will be helps to. This also will help to stop the bleeding. Okay. Only see only in a distance wise the knots will be there at the end, and below the straight horizontal line it will be. Okay, this is the horizontal mattress, whereas coming to the vertical mattresses, like vertically the stitches you will see fine. Okay, the vertical stitches, it's mainly used to close the skin wound, and also it helps to suture the both deeper as well as the superficial layer. Both can be sutured by this vertical mattress. Understanding? This is the vertical
Yes,
mattress.
ma'am.
Next, by seeing this, you can understand the what difference between the vertical and the horizontal. See the C and D, the picture C and D, it shows first C is the horizontal one. See, horizontal one, the deeper it will be like horizontal, but up you can see how far difference it is look like, and the D indicates the vertical one, and the downer part it indicates the how inside the skin it looks like. Understood? Next suture is a figure of 8. Figure of 8, actually in a figure of 8 we use observable sutures. Okay, we use only the observable material, and it is mainly used, see, like it's look like this. If it is a two wound, okay, suppose middle two side of a body is being infected, and you don't want to cut the middle part, so you will remove the upper part and the lower part, then you will do a figure of 8 stitching. See, like this. Can you see? Crisscross 8. That is looks like this. फिगर ऑफ 8 के जैसा ही दिखता है वो. Understood?
Yes, ma'am.
This is the next is the subcuticle. This is the last suture. This is a subcuticle suture, and this subcuticle we actually do for a cosmetic surgery only. We do the subcuticle, whereas in up, can you see here where the stitches will be done, but it won't be it won't be visible in the upper part. Okay, outside it will be not be visible. Okay, but the stitches will be done. The sidewise the stitches will be done, but it will not be cosmetic surgeries and all you have seen. See, for every suture there will be after the suture the scar mark will be there, right? But for cosmetic surgery, people will not be willing to get a scars, right? The mark should not be there. So because of that, this type of the subcuticle sutures will be done for the cosmetic surgery, so that there will be no marks will be left out when once after the stitches is been absorbed. Is that clear?
Yes, ma'am.
Okay, till now we have seen the suture knot, cosmetic the different types of knot. How continuous suture, how you should put a knot. Okay, one is the square knot, second is the surgeon knot, third is the okay or a slip knot. Knot. By a double loop, the knot will be done. See, one down you will put first knot, next on top knot. Okay, two knots will be formed there, and the square knot will be done. It will be easy to put a knot in a cotton as well as in a stainless steel. Okay, in all those materials you can put this such type of knot, square knot. Is that clear? Next is a surgeon knot. Here, how the surgeon knot be? See, here first procedure was we will put the knot in a crossway, then you will tie, and once you tie, the double knot will be done in a square knot. Understanding? Whereas in a surgeon knot, you can see first you will make the thread crossway, okay? Then you will put the knot, then it will see the last one. How continuous you do. Are you understanding?
Yes, ma'am.
This is the surgeon knot. Okay. In the future, this surgeon knot can be done now. That this knot will be easier. You can't do it in a silk materials. Okay. Next is the granite knot. It's the last one. The granite knot. It looks like this. The one direction will be one knot and the other direction. When there will be a stitches you do in a two thread. Okay, if you do a stitches in a two thread, then you can do the granite knot like this. In one thread, can you do like this? It won't be. Okay, only when you do with the two thread, then this granite knot will be possible, and it can be used in a silk, chromic, or a plain cadre. Okay, the material used. And these stitches will stay for a permanently. Okay, there will be no, and it will be easy to put a knot. Okay, so like this, and there will be a less chance of bleeding also, and less chance of opening of wounds. Is that clear? Understood? The three knots, square knots. In a square knot, first we will put a crisscross way, then you will tie a knot, then double knots will be done. Okay. Then in a surgeon, crisscross you will do. Then invertedly the stitch overlap will be done, and it will be a continuous. Like this, the knot will be at the end. When you see at the end of the stitch, the knots will look like this. Then the granite knots, the one knot will be followed by another one. Okay. Next, we will see the how you will remove the stitches. See, these are and for fish, the stitches will be removed from 3 to 5 days. In a lips, 3 to 5 days, and oral cavity, neck. Okay, if the stitches which has to be removed, at least it's max to max, it should be a 14 days. Okay, if it is major surgery in abdomen and legs, on chest, anything, at least it should be removed within the 7 to 14 days. What happens if you keep the stitches for a longer time? What happens if you doesn't remove the stitches after 14 days also? the infection may starts, right? The decaying of sutures will start, and that smell also will start. So at least within 14 days the sutures has to be removed. Okay, depending upon the parts where the sutures has been done, depending upon the wound and depending upon the severity, the sutures has to be removed. Is that clear?
Yes, ma'am.
Next is the, what is the principle? What thing you have to keep in your mind before removing the suture? As you know, suture has to be first cleaned with the normal saline. Yes, soon after the patients come to the hospital to remove the suture, you can't just rush it out and go and remove the suture with your bare hands. No, first you have to clean the suture with the normal saline. Yes, then you will hold the, first you will start, you remove the stitches by middle. Suppose there is a continuous suture, you can't cut the suture in middle. You can't start with the cutting from the middle. First, you will cut the knot. The side one knot will be there. No, the knots will be grabbed in a scissor. In one hand, you will hold the tooth by the forceps. You will hold the knot, and another hand, in a right hand, you will cut the suture. Okay. Then by one, if depending upon the way the stitches is, one by one you will remove and you will discard it in the kidney tray. Is it not? Can you remove the stitches? One stitch you can, the knot you will remove, and can you pull the stitches so that it will be easy? Can we do like that? No, you can't. You can't cut a single suture and you can't pull it out. Okay, you can't do like that. You have to cut each suture, each knot you will cut, and slowly you will pluck it out. Okay, and after that, soon after removing the suture, you will put a normal saline. Again, you will clean it off. Then you will put a cotton pad on the suture place, and you will cover with a micropore or with anything. You will cover it off. Okay, because it is a new suture, it might be having, it may expose to the infection. The person may infect with something. So you will cover the part at least for 1 day. Okay, soon after the removing the suture, at least you will cover the part with the cotton swab or with a cotton pads, okay, or with a gauze pieces, you will cover it. Is that clear? Next, see, this is the way how,
Yes.
see, you can't hold the needle only single knot and you can't cut it. The whole knot has to be hold. See the second one where they have mentioned no, एक को पकड़ के दोनों thread नहीं कटने. At one time one thread has to be cut. Okay, single thread should be kept, and that should be plucked it out. Okay, once you go to hospital, you can identify how it is been removed. This is the thing. Okay, why? And if there is left out pieces, the suture material, if it is left out, any threads are left out, and that may lead to so many infections and bleedings. Yes, no? So that is the reason for failure of a suture. If it is a breakage, if it is a cutout, if not slips, while during the cutting of a knots, if it is slips, and if it is extruded suture, what do you mean by extruded? If it is stitches done in a subcutaneous or in a intradermal, the extruded sutures mainly it is found in a intradermal, in those area. If it is failure, if intradermal means it is a very minute one, it will be like, it will be very difficult to cut the knots. So if it is slips there, and that will be a failure of a suture. And if it is reabsorbs too rapidly, okay, if you have used an observable material, observable suture, if it is reabsorbed soon, then before the wound get healed, if the sutures get absorbed, what happens? The wounds remains the same, right? What, there will be no use of doing the stitches. After, once the skin get attached, once there will be once there will be attachment of a skin, then if the suture material get absorbed, then that will be okay. Before the skin get attached, before that only, if the suture material get absorbed in the skin, what happens? That will be a failure, right? And if the sutures, if you remove it too early, you cannot remove the sutures too early. Like today you have suture, tomorrow if you go and remove, whether there will be healing process takes place, there will be no heal. Okay, the wound will be remain same. The skin wants to heal it up. The skin wants to come back to normal position. Yes, no, because of that only we do the sutures. right? Is it not?
Ma'am.
These are the complications. How that might be this seen in a few members looks like this. Yes, no, we have found many of us have this suture marks. The suture abscess looks like this. The pus formulation will be or blood collection will be left out if the proper removal of suture doesn't take place. Okay, and the mark, the stitch marks will be, and the dermoid cyst. Dermoid cyst means dermoid cyst in the nothing but in a skin there will be a cyst formation. Okay, like a pimple. It will be a form on the top of the suture which grow rapidly and it will be tender. Tender means when you touch, you will feel the pain. Only during the touch you will feel the pain. Other than that, you will not feel pain. Okay, that is nothing but the skin will grow on top of the suture. Okay, if there is no proper removal have done. Okay, and you know nowadays we in cesarean session or in some other suturing we doesn't go for this knot like sutures. Okay, now the modern technique has been implemented, the stapler one. Have you seen, have you witnessed ever?
No, ma'am.
Yes, ma'am.
This is the stapler one. We use this stapler one in a recent one, but thing is the main disadvantage of this is advantages is it is less time consuming compared to stitching. Compared to other than other sutures, it is very fast. Yes, you will take the stapler or the machine and you will stapler it soon. But the disadvantage is the metal may have a reaction on a person. Okay, that it may react. It may leads to infection. Okay, everyone for every skin it doesn't suit. Okay, because of that will be a disadvantage of a using of stapler. Is that clear?
Yes, ma'am.
Yes, ma'am. Yes, ma'am.
Understood the principle of suture? Everyone? Yes, I will send you, as this is only the diagram things, whatever you have understood, you can write it down. If once you come back, I will tell you the definitions of those things. You can write it down, okay?
Yes, ma'am. Ma'am, continuous over and over suture. Repeat, ma'am.
I will see. See here it will be the sutures will be in a zigzag way. Only one end will be at the end only the knots will be, not in every stitches, only the ends will be having the knots and the stitches look like zigzag way. See, over and over. Continuous कहीं पर stop नहीं होता है, continuous suture ढाला जाता है, लेकिन end में ही knot ढाला जाता है. Like see here why it is said that continuous over and over, because here in a sideways there is a loop. Okay, एक के साथ एक जुड़ा हुआ है, लेकिन यहाँ पर you can find the difference. एक के साथ एक नहीं जुड़ा हुआ है. Can you see this?
Yes, ma'am.
Yes, ma'am.
Yes. Got the difference? Here it will be in a zigzag way, no overlapping, no side knots. Okay, only the end will be having the knots. Is that clear? Everyone.
Yes, ma'am.
Once you come back, we'll have a demonstration. Okay. We'll continue in the next class. Other things? Yes.
Yes, ma'am.
Yes, ma'am.
Write down the notes, whatever you understand, whatever I sent. Okay. If you don't understand, let me know. Feeling boring, this topic, pre-operative nursing? Is it boring?
No, ma'am.
Huh?
No, ma'am.
Okay. See you all tomorrow, okay?
Thank you,
Okay.
ma'am.
Thank you, ma'am.
Thank
you, ma'am.
you.
Bye, bye, ma'am.